and welcome to our show today. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program. Today I'm joined by Mindy Cartwright, a breast navigator and mammographer at Baptist Health Paducah, and Amy Anderson, an oncology nurse at Lourdes Outpatient Infusion Center at Mercy Health Lourdes. Today we're going to discuss cold cap therapy and its availability here in our community. Chemotherapy is oftentimes a course of treatment many patients receive dealing with a chronic disease such as cancer. One side effect to chemotherapy is potential hair loss. Cold cap therapy can help bring a person a sense of normalcy in the midst of an emotional storm. Mindy and Amy, thank you for joining me today, and we certainly look forward to learning more about this topic and more about you all as well. So, Mindy, if you want to start by just giving us a little bit of background on who you are and what you do.
Okay. Well, I've been a mammographer at Baptist for 25 years. I'm also a breast navigator, and there's many aspects to my job. My main focus is establishing a relationship with the patient the moment that they have an abnormal finding on a breast imaging exam. It's at that time that they're for their biopsy, and then depending upon the results of that biopsy, if it does come back positive, I can follow that patient through their course of treatment. I can provide resources for them or for their physician, and just be a guidance for them as they go through the process of the treatment that goes along with breast cancer.
Certainly, a cancer diagnosis can be overwhelming.
Yes.
And a lot of information, and a navigator can certainly bring some peace and calmness to that aspect, not only for the patient, but for caregivers and
most of the fear
members.
comes from the unknown. If they have someone there that they can rely on to help relieve some of that unknown, answer their questions, kind of provide resources if there's any barriers that they come across as they go through something, I think it just does alleviate a lot of the anxiety that goes along with a diagnosis. So
Sure. I even think it's important too when you talked about just abnormal findings and allowing patients to know that sometimes it may not be anything.
Right.
But
and
this
that's
is
the good
course.
news. When they come back with an abnormal finding, in most cases, we're able to let them know that it's nothing to worry about.
Sure.
But there's those few small percentages that they do end up having to have the biopsy, which does turn into something positive.
Absolutely.
So, but I try to be there regardless. That way, when they're there, I can answer their questions, whether it turns out to be anything or not. So
Great. Well, we certainly appreciate you being here today and learning
you.
more about what you do, and especially dealing with cold cap therapy. So.
Yes.
Amy, welcome to the show today.
Thank you for having me.
If you will give us just a little bit of background on your history as well and what you do at Lourdes.
I work in the Outpatient Infusion Center alongside 6 or 7 other infusion nurses. We are usually the first chemotherapy step.
Okay.
You know, patients come to us, we see them throughout their entire treatment. So we start their therapy and finish their therapy with them. The cold cap is exciting and new, and we're learning together. I've been a nurse for 5 years, and I have been with Mercy Health since the beginning, and I have always worked in oncology.
Okay.
So
Definitely, it's different than other nursing fields.
it is. It is. I was fortunate enough to work a medical floor where there was medical and oncology, and that's how oncology became a part of my passion, a part of who I am, and where I felt like I could do the most good for the patients.
And I guess working in the outpatient center, your patients obviously sometimes may come more frequently, some may come less, but you definitely are building a quick rapport and relationship with those patients as well.
We become family.
Yeah.
We become family.
Good. Well, today what I really want to start with before we dive really deep into what cold cap therapy is really talking about some of these side effects that I mentioned in the introduction with hair loss. So what does hair loss potentially mean to someone that's been diagnosed with cancer? You talked about the emotions involved with a diagnosis. So what are those patients feeling and saying to you when they do receive that diagnosis?
well, I think first it's that overwhelming feeling of being diagnosed, and then it's all the questions that follow, and one of them is the alopecia, which is the hair loss that goes along with the treatment process of chemotherapy. And so many things are out of their control.
Sure.
And it's nice to know that with the cold cap therapy, they gain a sense of control back. You know, when they look in the mirror, that it's that constant reminder of their cancer diagnosis. So with the cold cap therapy, they have a sense of normalcy again. I know one of our patients that are currently going through the cold cap therapy, she works in healthcare.
Okay.
And she said, it just gives me the confidence to go to work every day. I don't feel like I have to explain what I'm going through to my patients. You know, I can still continue to show up for work every day. The people I want to know, and the ones that I don't want to know, then I can keep it private. So it's that privacy, it's that normalcy, and just knowing that they've gained some of that control back that sometimes they lose whenever they are going through a cancer diagnosis.
I guess, Amy, you've probably experienced the same thing with patients.
The first question on diagnosis day is always, am I going to lose my hair? That's a big deal. It's a big deal for young mothers. It's a big deal for professionals. People, they don't want to be viewed as sick.
Sure.
A lot of our patients will come in, have treatment, and then they go to work. And they don't want to answer the questions. They don't want to spend all day explaining to people that they have cancer, and they really don't want that stigma. They don't want people to feel sorry for them. They're fighting. They're fighters, and this has given them a sense of pride and keeping them going.
Yes. I'm sure we've all seen some of the videos, or have known people even close to us that have gone through cancer treatment, and that's a big decision when the person is losing their hair to make the step to even shave it. And it becomes a huge milestone within the course of treatment. So cold cap therapy certainly can make a huge difference with that, and there's probably a lot of patients that wish it were available when they went through treatment. So let's talk a little bit about exactly what cold cap therapy is.
Okay.
Who wants to start with that?
Well, cold cap therapy, what it does whenever a patient loses their hair, it's what happens is the chemotherapy actually attacks the hair follicle, and that's what causes the hair to fall out. So there's a pre-cooling, a treatment cooling, and then a post-cooling time that goes along with it. So we want to get the scalp cool in the first 30 minutes before they start their chemotherapy. So once it reaches the temperature of the scalp being cool, then it prevents the chemotherapy from getting to the hair follicle. It like constricts the blood vessels, prevents blood flow from getting to the follicles, which is what causes their hair loss. So.
Okay. And how exactly do you get the patient fitted for a cooling cap?
Our fit process, the patient comes to us, we turn the machine on, we let them see the machine, feel the machine, we plug the cap in. There are 3 sizes to the cap. We put it on, determine which is best for them. There are 3 neoprene covers to the cap. They all come in different sizes, and we size the patient, make sure the patient understands exactly how cold it is, what to expect when they get there for their first treatment, and how to prepare. But mainly trying the caps on, making sure that the cap fits.
Sure. Do patients receive anything to help keep them a little warm during the process, or are they forced to sit in a chair with just the cap on?
We offer them warm blankets.
Okay.
I know a lot of them come with like a scarf around their neck, because the tubing that's attached to the cap, it gets really cold to their neck.
Oh, okay.
So they usually will have a scarf on, but warm blankets, and just wrap like it's, you know, winter outside basically, because it gets cold. I mean, when they take that cap off, some of them even have like ice crystals that have formed in
wow.
their hair. I mean, it gets that cold.
Okay.
So.
Any other thing, Dad?
Electric blankets.
Yeah, that's a good
Just
idea.
be
Yeah,
warm.
yeah.
Right.
I let them use heating pads, electric blankets. We use compression therapy a lot of times,
Okay.
and that kind of helps keep blood, you know, moving
Sure.
and flowing. The first 15 minutes are the absolute worst. They are miserable. The cap does cause headaches. It's very cold. It cools the scalp to maintain a temperature between 64 and 72 degrees. That's optimal, and it's cold. So they're cold, they're uncomfortable, but every single patient has said after 15 minutes it is completely doable.
Okay.
It's manageable.
So let's talk a little bit about the system. So cold cap therapy isn't necessarily new. There used to be different caps people could just get and wear, but these cooling systems are different from just a cold cap per se. So let's explain the difference and how FDA is really involved with these systems as well.
Well, before, it was a lot of work. And I still think some people actually do it this way, but you would get a cap and you would have to put it on dry ice. Of course, you have to order the ice, and I think it gets brought to you somehow. And then every 30 minutes, you would have to swap out the caps because they don't stay cold very long.
Okay.
So after 30 minutes, you have to get another one out of dry ice. I know some places actually have like a biomedical freezer, but if the facility doesn't have a biomedical freezer, they would be just on dry ice, and you'd have to have like either a nurse or someone with you to be dedicated to swap these caps out every 30 minutes. So it was a lot of work.
Okay.
As far as the FDA, I know the Paxman, it was approved by the FDA in 2017, and then the DignaCap was the first one to get approved, and it was in 2015.
Okay.
But this is just so much more efficient, so much easier for the patient with it being a constant temperature that circulates through the cap, just remaining, containing that constant flow of temperature just makes it a lot more effective.
And let's talk, before the show, we briefly talked about some things, but one thing you all did mention was the support that you all receive from the companies, the manufacturers of these, and what patients receive. So kind of explain to our viewers today what kind of support you all get with these systems from the manufacturer, but also what patients can receive.
The Paxman was developed by a gentleman whose wife had breast cancer and had lost her hair. He was an engineer, and he thought, I can do something about this, and he did. The Paxman cooling unit has been around since 1997, but only in the U.S., like she said, since 2017. So they are the most customer service friendly group of individuals I have ever encountered. When I call, they answer the phone. It's not automated. When a patient is sized, we fax their information, and the patient has their cap in their home 48 hours later. Questions, concerns, comments, refunds, they're wonderful, absolutely wonderful.
Sometimes that's a huge barrier for patients, right? You might get a device, but then it's not user friendly, or there's problems with it, and then you can't get any help and assistance with it. So that could be a barrier that would maybe cause someone to be hesitant about that, but giving them the assurance that there is help can make a huge difference.
Yeah.
Absolutely.
And I think it's become like a family business. I think like his son and like daughter and all of them, it's like all the family works for this company now. So it's really neat how they've kind of incorporated into more of just like a family business.
That's great.
Yeah.
I love stories like that too, where it's family member. I've had some other experiences with other medical equipment where it's been a family member that saw another family member struggling and said, I can do something about it.
It's personal.
Yes.
It's personal to them, and they make it personal, and they create that personal relationship with every patient.
Yeah, they've been there. They know how it feels.
Absolutely.
Yeah.
So you did mention that the cap gets sent to the patient's home, so they're not going to come to the hospital and pick that up on the day of treatment. So kind of explain the process that you tell patients and how you tell them to treat the cap once they receive it at home to get it back to the facility for treatment.
There's an information kit that we give the patients, and we tell them when Paxman sends them their kit, they get a CD. I encourage them to watch it. Okay. I can tell them all the things, but they are so overwhelmed with information and they're in overload. So I first tell them to answer their phone because Paxman will call them directly. Okay. So I say, answer the phone for all the 800 numbers because they're going to call you, and they do. And then I tell them, watch the video. Join the Facebook group, get on their website and watch the video, because that's where the questions are answered. What do I do with my hair? How do I treat my hair? And there are specific ways to treat your hair, and I want them to be aware of it. So it's been learning for me. The patients have taught me a lot, things that they have found on the website. They've been able to come back and teach me to help me teach others.
Yes.
So answer the phone, watch the video.
Yeah.
That's the important steps.
That's the big thing.
And I agree with Amy. It's like the patients are a huge source of information, and how they're able to have tips that they've learned as they go through it that we can pass on to the next patient. We were talking earlier too about, the headband that comes with the cap, and how it doesn't always work because of the way that the seam digs into the forehead, and
Sure.
you know, using a panty liner or some kind of gauze or something, makeup swab, something like that to put there. The panty liner, like I said, works good because of the adhesive and the moisture that it absorbs whenever the cap is on. So just little things like that that you just kind of figure it out as you go, and you know what works, and you're able to pass it on to the next one. So
I think it's definitely interesting to listen to you all talk, because whenever I first think of a cooling cap, I think this is just something easy. I just slip on my head. It's attached to the, you know, system in the back that's going to provide the cool air. It's not rocket science. I'm just going to slip it on and off and we're good to go.
Yeah.
But there definitely is much more to it from what you all said, and these little tricks. And so Amy, you were mentioning too that some people may not have a perfectly round head.
Everyone's head is shaped differently.
Sure.
And we've had patients who have had experienced bald spots. They've had excellent results everywhere, but they'll just have one spot somewhere on their scalp which means that the cap is not touching.
Okay.
And we know that. So the website has been very helpful, the Facebook page, because it's women all across the U.S. and abroad who are trial and error, and they're trying different things. And we have patients who use bungee cords. We have patients who use styrofoam. We have patients who use exercise bands, and some of them, you know, band around their head, wrap around their legs, and sit for sometimes 4 hours at a time and longer with those cords on. But they're also experiencing less than 20% of hair loss. So if the cap is not touching the scalp and not cooling at the consistent temperature, it will not work. And that's what we're learning. And unfortunately, with the first few patients, we learned the hard way, and we're getting better.
So I'm sure a lot of viewers out there are wondering that exact thing. How effective is this type of therapy? So it's relatively, you know, new. Obviously, there are several places that have used this for several years throughout the United States, or even outside the United States, because you said these systems are almost, 20 years old or more. So what are those benefits that people are seeing from that, the effectiveness of the treatment?
well, I mean, it's not a guarantee, and patients know that, especially if they've already got really thin hair to begin with.
Okay.
We have been successful with it so far, but there's going to be an encounter where it just doesn't work for whatever reason. It could be, you know, the regimens that they're on. So it's a lot of just giving it a try and just see if it works. But luckily, so far, we have seen a lot of success from it. They wondered in the beginning with this part of their hair over their ear, with it not being covered, that part might come out, and so far they've been able to keep their hair there. They keep their eyelashes and their eyebrows so far. And I know it's going to vary from patient to patient. You know, it may not be the case with every patient, but so far I feel like the success rate has been really good. Well worth them going through it when it was all said and done. And I know I've talked to patients about it, and they said if I had to do it all over again, I would do it again, because I know those 4 or 5 hours that I sit in that chair, when it's all said and done, it was well worth it. So
I think that's an important aspect to that when you said other hair loss, because eyebrows are huge, right? And
right, yes. I mean, people now, they spend lots of money on their eyebrows.
It definitely demonstrates a lot of expression on one's face too.
Yes.
It can show emotions, and so that is important as
Even
well.
like lash extensions, it's like that's a big industry now. So
Absolutely.
it definitely helps people just feel, you know, more made up, and without it, I can see where that would be even sometimes just as devastating as your scalp. So
Sure. It restores that privacy too, which you mentioned earlier. You know, you can let people know, or you may not have to let people know.
Yes.
So they can have that normalcy.
yeah.
And again, it's like what you said, something that they can't actually help control, because there are so many things that you are, you know, powerless over through treatment. Definitely. Well, so let's talk about, you mentioned just real briefly in your statement a while ago about caring for your hair while you're going through the treatment. So how would you treat your hair differently using cold cap therapy?
Well, they want you to use cold water.
Okay.
That's a big deal. They don't want you washing every day. They want you to limit washes to once a week, twice a week at the most. Paxman sends a specific shampoo in their kits, and a conditioner. The conditioner is so that when we're finished, the cap will come off of your frozen head. Yeah. But the shampoo, they don't want you to use it more than twice a week. They want you to use only that shampoo. Keep the heat away from your head. No hair dyes. No blow drying. Run your fingers through it. You're being kind to your scalp, giving it just a little bit of stimulation, versus what it's used to.
I know the kit comes with a detangler brush, but I think patients have found, I don't know if you found this or not, but a wide tooth comb I think sometimes works better, because that detangler comb or brush, I don't think it gets the tangles out as well as like a wide tooth comb, and I don't know if that may be something that
everyone just brings their own, usually from home, but.
Yeah, but it's pretty much wash and go. It's like you don't, no really any products in your hair.
No chemical.
Yeah.
So I guess to that extent, people might wonder, does the shampoo have any scent to it at all, or is it just plain?
Just plain. Just plain.
Yeah.
At least they give you some conditioner.
Takes all the frills out of hair.
Yeah.
So are there any risk associated with this type of treatment for a patient? That's always one thing people want to, weigh before they decide on a therapy. So what are any risks?
Well, it's contraindicated in people who have blood disorders. So it's not used head and neck. Obviously, if you have metastasis to the brain, neck cancers, it is for solid tumor cancers only. So more breast cancer patients seems to be using it. At Mercy, we only have breast cancer patients using it right now. So and it causes headaches. It's cold, very cold, and very uncomfortable. So there are people who have disorders to cold. I don't know what it's called, but I do know it exists. And so there are just people who can't stand it.
And I think even like taking like a Tylenol, Excedrin migraine, something like that before they get started has seemed to help too. And it's kind of controversial right now, but there's even like a minimal risk of like scalp metastasis, but that has not proven effective so far. It was just something that has been mentioned and that they're I think putting some research into, but so far there's no reported cases of that, because I think that was a question that some people had asked, is if there was a chance of any metastasis to the scalp, and so far there's no report of that.
One thing that comes to my mind too is, this therapy is now available, but how do you identify patients that may qualify for that treatment? Is it standard protocol to offer it to every patient, or with breast cancer obviously for right now, or is there a selection measure that you use? I mean, obviously they would probably need chemo treatment. It would have to be part of their treatment plan, but
we let them know it's available. That's a doctor's office. When they're in the office and they're discussing their treatment regimen and what they're going to go through, that's when the practitioners and the physicians, the nursing in that facility says this is available. Cost is a question. It's brought up almost immediately. Right now, Mercy is providing this service to their patients completely free of charge. I don't know how long that will last. But with the help of Mercy Foundation and local businesses, that's something that is taking the burden off, because it is very expensive.
And then Baptist helps assist.
Yes, they pay the initial cost of the kit. We have our Fight Fund Foundation that I know some patients have benefited from. Actually, one of our patients too that's going through it right now, it was actually a gift given to her. So I thought that was just so neat that,
It's awesome.
It's just something to think about. Churches or co-workers or some, people are going in and providing this as a gift for someone that they know is going through it. I know Paxman actually has a foundation too called Hair to Stay, and they promote that on their website. So if a patient had any kind of financial problems, they could go to Hair to Stay, and there's a foundation set up for that too.
Well, I think that's a good point too to viewers, because obviously cancer treatment is not something that's easily affordable to some. Obviously insurance covers that to a degree, but some people may have no insurance, or they may have higher deductibles and things like that. So this therapy being able to be covered can make a huge difference.
Yeah, and I know it's all
person.
being under review right now, and I can foresee that eventually, hopefully, this will be something that all insurance companies will grab hold of and realize the benefits from it, just the psychological effects
Sure.
and everything that goes along with it.
Sure. Well, we've definitely encouraged patients then to check with their insurance to see if it is covered or will be covered, and then to talk to your doctor to see if this is something that may be a benefit to you as they go through treatment.
It's new. It's new here. There's not a lot of information about it locally. There are only 44 sites in the U.S. The closest site to here is Memphis. I don't. I'm. If Nashville has it, I'm unaware of it. But what we're doing here, this is the education. It's our job to tell people about it and see that it's working. And as a nurse and someone who offers the service, you're a little cynical at first. You're just a little bit, it's a uncomfortable time for people, and you want to see it work and be successful. And I think that's the greatest thing about it, is seeing it work, and it is working.
And it takes a dedicated healthcare team in order for that to work, for them to be able to encourage you and not give up, and to know, hey, this, if you will just hang in there, we've seen patients that go through this, and you just have to not give up and just keep trying, and it gets easier every time. And so I think it does help to have people that are dedicated and willing to encourage you.
Very well said. Do you all have anything else you would like to say before we end the show today to our viewers?
Don't give up. Just keep fighting. It's a battle, and no one fights alone. We'll climb it together. We'll learn together, and we'll change it if we need to change. And just don't give up. Just for them to know that no one fights alone.
Yeah, that's my main thing too, is you're not alone in this. You walk in our beautiful cancer center, and it goes beyond just what you see visually. We've got a cancer team that are there in every aspect of your care, and we'll get through it together.
Thank you, ladies, so much. I think we're very fortunate to have facilities like this in our community that care about patients, care about providing services that can impact their cancer treatment and make a huge difference and make a person feel normal. So thank you for sharing this information today. I certainly learned a lot. I hope you at home today learned a lot as well. And if you have questions about today's topic, please feel free to reach out to our office, the Kentucky Cancer Program, at 270-442-1310. Thank you for joining us today, and we'll see you next time.